Hello, I'm Dr. Darren McGuire. Welcome to More Than Lowering Blood Sugar, Protecting Your Heart in Type 2 Diabetes. This series is provided by CME Outfitters and is supported by an educational grant from Novo Nordisk, Inc. This is the first of 3 patient education webisodes and will cover the cardiovascular risk associated with Type 2 diabetes. Again, I'm Dr. Darren McGuire. I'm professor of medicine at UT Southwestern Medical Center in Dallas, Texas. I've worked the last 25 years, both clinically and in research, on the intersection of diabetes and cardiovascular disease, which we'll be talking about today. First, know that you're not alone. Diabetes affects many people in the United States. In fact, over 37 million adults in the U.S. are living with type 2 diabetes. Diabetes affects more than 1 in 10 adults in the United States, and about 1 in 5 people with diabetes are unaware that they have diabetes. So it's important to get tested and be screened for diabetes, as well as manage the disease once it's present. Diabetes is not just about blood sugar. It affects the heart and kidney disease risk, and we'll focus today mostly on the heart disease risk associated with type 2 diabetes and the care of diabetes that goes well above and beyond the management of blood glucose alone. Today, we're going to focus on your heart. Cardiovascular disease is the #1 cause of death in people living with diabetes. The risk of heart disease or stroke in patients with diabetes, about half of individuals with type 2 diabetes aged greater than 65 will die of some type of heart disease. About 1 in 6 will die of a stroke. Women are 4 times more likely to have heart disease when they have diabetes than women without diabetes, and men 2 times higher risk of cardiovascular disease with diabetes. ASCVD, or atherosclerotic cardiovascular disease, is associated with type 2 diabetes. Here you see how the risk of ASCVD and diabetes goes up with age. Among adults 18 to 44 with type 2 diabetes, already about 15% of them will have detectable atherosclerotic cardiovascular disease. In the middle ages of 45 to 64, more than 1 in 3 persons with type 2 diabetes will have atherosclerotic cardiovascular disease. And by the age of 65 and above, over 70% of persons with type 2 diabetes will have clinically relevant atherosclerotic cardiovascular disease. Let's talk now about how diabetes can damage blood vessels and what this means for your health. Atherosclerotic cardiovascular disease, as we mentioned, is part of type 2 diabetes, not just the hyperglycemia or high blood glucose of diabetes, but the associated high blood pressure, high cholesterol, other lipid abnormalities, inflammation. These all lead to increased risk for atherosclerotic cardiovascular disease or blockages in the arteries. These can lead to heart attacks, to strokes, to heart failure, blockages in the arteries of the arms and the legs, also known as peripheral arterial disease, as well as contributing to decline in kidney function and affects eye problems or visual acuity, including blindness in some persons. Type 2 diabetes and cardiovascular disease have a lot of shared risk factors for cardiovascular disease, including high cholesterol, high blood pressure, excess body weight, not exercising regularly or prolonged sitting, tobacco use, either primary smoking or secondhand smoke exposure, as well as family history for both type 2 diabetes and cardiovascular disease. These are data from the Swedish National Diabetes Registry. In Sweden, all persons with type 2 diabetes are registered in a single database that I've had the privilege of analyzing with my collaborators in Gothenburg, Sweden. And this is one of our publications about the prevalence of common risk factors for cardiovascular disease in a population of people with type 2 diabetes. And as you can see, hypertension or high blood pressure affects over 60% of people with type 2 diabetes. High blood cholesterol, hypercholesterolemia, 37%, and smoking is still 13%. Despite the fact of having type 2 diabetes, people are still smoking, and this is an important risk factor to modify. You should be aware with type 2 diabetes the signs of cardiovascular complications, including the signs of a heart attack. This includes pressure or squeezing in the chest, fullness, pain in the chest or upper body. Can just be shortness of breath without chest pain. Women sometimes have different heart attack symptoms than men and can include nausea and vomiting, fatigue, pain in the back, shoulders, or jaw. And these final 3 symptoms can also occur in men, but perhaps more commonly occur in women. Signs of a stroke are numbness or weakness in the face, arm, or leg, especially on one side of the body. Confusion or trouble speaking or understanding speech. Trouble seeing in one or both eyes. Trouble walking, dizziness, or problems with balance. Severe headache with no known cause. Signs of heart failure may include shortness of breath, even when doing simple tasks, shortness of breath that gets worse when lying down and better when sitting or standing, swelling in the ankles, primarily in the ankles and feet and legs, also can be in the abdomen, extreme tiredness or fatigue with a little bit of activity, feelings of weakness, rapid or irregular heartbeat, and very rapid weight gain, such as 3 pounds in one day or 5 pounds in 1 week. Heart failure is one of the first manifestations of, or cardiovascular complications of type 2 diabetes when they have cardiovascular disease. Here you can see, second only to peripheral arterial disease, heart failure is the second most frequent first cardiovascular complication in persons living with type 2 diabetes. It exceeds in incidence non-fatal myocardial infarction or heart attack. It exceeds stroke and cardiovascular death. So heart failure affecting about 14% of adults with type 2 diabetes. Signs of peripheral arterial disease may include pain known as claudication that gets worse with exercise and improves with rest, numbness in the legs with or without exercise, and issues with circulation in arms and legs. When faced with cardiovascular risk, lifestyle changes are a critical element of care. Lifestyle modifications are not easy. We encourage them for every person with type 2 diabetes, as well as those without diabetes, but more importantly than ever in the setting of type 2 diabetes, to adopt healthy lifestyles. Questions I hear from patients in the clinic: what can I reasonably do to lower the cardiovascular risk associated with my type 2 diabetes? We'll talk about medical therapies in webisode number 2, but very important to adopt healthy lifestyle practices, healthy eating, physical activity on a regular basis, achieving and sustaining healthy body weight, avoiding tobacco. If my blood sugar is well controlled, does that mean my heart health is in good shape? It means your overall health is in good shape if your blood sugar is well controlled, but there are other features of cardiovascular risk that also need equal attention, and that includes high blood pressure, maintaining a good blood cholesterol management, and lifestyle interventions, as we mentioned. These all can complement good glucose control in the management of type 2 diabetes. How do we monitor my heart health while also managing my blood sugar level? Typically, we'll simply ask questions on the history when we see you in the clinic, and maybe focus physical exams looking for any troubles from the cardiovascular system. When and how often should I have exams or tests to check my heart and blood vessels? Typically in the clinic, we don't routinely monitor heart health with diagnostic testing unless we have some suspicion there's a problem. The monitoring or diagnostics can include an EKG, and we can do that in the clinic, an ultrasound of the heart or an echocardiogram. CT imaging of the heart can now be done. We can see the blood vessels of the heart. And for patients at very high risk or compelling symptoms, we may go straight to heart catheterization to take x-ray pictures of the heart arteries to evaluate for blockages. Lastly, I tell my patients there are resources available online to support diabetes care, including reducing cardiovascular risk. The links on your screen represent just a couple of these. These are 2 websites curated by our cardiology associations in the U.S., both the American College of Cardiology and the American Heart Association. Each of them have patient-facing portals to access information about diabetes as it relates to cardiovascular risk, how you can take care of yourself, how you can monitor for disease, and what symptoms you might be on the lookout for. So thank you for participating. Don't miss webisode number 2, treatments that address type 2 diabetes and cardiovascular disease. And don't forget to tune into webisode 3 with Kimberly Ellis, aka Kim E, the Diabetes NP, who will share ways to be more engaged and proactive during visits with clinicians, including questions to ask about your heart health. Thanks again, and stay well.